Hi, I'm Dr. Steve von Elten. It's Thursday, April 23rd. I'd like to talk to you a few minutes about where we are with testing and mitigation. The local testing for Fauquier, Rappahannock, and the neighboring counties is presently being performed with the assistance of the Virginia Department of Health at our Piedmont Urgent Care Center. And that testing is predominantly a curbside testing. It is being done with a physician's order. You can look at the previous video and get more detail on that. But if you call your provider, they can give you an order, and then from that, then you can go to the testing site, and the nurse will come out with a personal protective equipment, swab you, and send it off. The turnaround time presently is about 2 to 5 days. It's come down from the 8 days. Things are proceeding very well. We have tested over 450 patients to date, and the good news is we have over 550 swabs available for testing. Because of this, we have gone ahead and lowered the criteria so that if we have a suspicion, if somebody has this disease, we believe they should be screened. The more screening we conduct, the more patients we find that have this disease early on, hopefully we can help mitigate the spread of this disease. We also have now serologic testing. That's testing for an antibody, an IgG antibody. The IgG antibody takes somewhere between 3 to 4 weeks to become positive if you have this disease. Therefore, this is not a test. Serology test, antibody test, is not a test for an acute illness. It is a test to tell if you've had the disease sometime in the past, and that's its usefulness. Whether you should be tested to see if you've had the disease is really for a discussion between you and your physician or provider. The last thing I'd like to talk about today is reinforce once again mitigation. Mitigation is the prevention of spread through the disease. How do we do this? Well, the first thing is, to explain, this is a disease for the most part is spread person to person through droplets. I know everybody's out and concerned about wearing gloves, handling bags, handling boxes. Doesn't particularly concern me. The risk getting it that way, I think, is truly kind of low. I don't worry about my shoes when I come in, but I do worry about my hands, so I do wash my hands. But most importantly, it's the concept of wearing a mask when you're out. Now, when you wear a mask, that's not to prevent you from getting the infection. It's prevent you, if you're asymptomatic or if you're asymptomatic, from spreading it to others. But if everybody wears a mask, then that helps mitigate the spread, as well as keeping social distancing, keeping 6 feet away potentially from somebody. Because if the social, within that 6 feet, if somebody's coughing, sneezing, or even talking and raising droplets, you don't want to inhale them. So that's very important. Along with this, we should really watch social gatherings where families and friends get together. If you need to get together with a family member to ward off the intense feelings of loneliness and isolation, try to do it in the afternoon when the weather's good. Sit outside, stay 10 feet apart. Don't hug, certainly don't handshake, and if you do that, you'll go a long way to prevent the spread. Also, very importantly, if you need to go to the store, don't take your kids to the store. There is no reason to take your kids to the store. Only one person in a family unit should be going into the store, getting what's needed, and leave. When I go to the store, I make sure I wear my mask, I use hand sanitizer, I pick up the things, I leave the store, I use the hand sanitizer, I put my bags in my truck or my car, I come home, I unload them, and once I unload them, I wash my hands. That's so terribly, terribly important. The last thing is, if you are sick, or if you think you may have this disease and you've been tested, it is very important to isolate. But when we say isolate, not only you should isolate, But everybody that's been in contact with you in the family unit should isolate as well till you get those results back. If you've been sick and if you go off and you stay in one room of your house and one separate bathroom, if that's possible, that's great. But other people in the family have probably been exposed also, and they should not continue business as usual until you get that result. They should be staying in and isolating themselves from their friends and whatever is possible. Hope these tips are helpful, and soon I'll cut another video and give you further updates about where we are with therapies and future diagnostics. Take care, stay healthy, and be well. Be safe.